Let us figure out how to assess this patient with hematochezia. Majority of the patients with hematochezia, the source of bleeding tends to be from the colon or in the rectum. However, you should also ask yourself this question: is it an upper GI bleed, especially if the patient with hematochezia is hemodynamically unstable and if they have a history of peptic ulcer disease, or if they have a history or clinical findings suggestive of liver disease. In these two situations, peptic ulcer bleed or varicose bleed, if they are massive, the blood can come down the GI tract and present as hematochezia. And in order for a patient to see blood, not melena, they should have a lot of bleeding. In addition, you should also consider the possibility of an upper GI bleed in any patient who is on aspirin or any other antiplatelet therapy, because these drugs can cause ulcers and those ulcers could bleed. Again, if the patient is on any antithrombotics, the bleed tends to be quite massive, and you should also consider looking into the upper GI tract. So, from the history, if the patient has an ulcer disease, or if the patient has liver disease, or if the patient is on antiplatelet therapy or antithrombotics, especially if the patient is hemodynamically unstable and has hematochezia, think about the possibility of an upper GI source of bleeding. And when the labs come back, make sure you look at the blood urea nitrogen and creatinine. And if the blood urea nitrogen to creatinine ratio is more than 30, you should also consider the possibility of upper GI bleed. With these two things, a history that makes you suspect, a lab value that makes you suspect an upper GI bleed, then you should consider putting a nasogastric tube and aspirate the gastric contents. If the gastric contents are bloody, the possibility of an upper GI bleed is high, and you should consider an upper GI endoscopy before doing a colonoscopy. If the nasogastric aspirate is not bloody, but you have a strong suspicion of upper GI bleeding, then you should plan for an EGD as well. This can happen if the pylorus goes into spasm and the ulcer is in the duodenum which is bleeding, and there is no reflux of blood from the duodenum into the stomach, then nasogastric aspirate could be negative for blood. I hope this is useful. Thank you.